Hi, my name is Casey King, and my research is accessing mental health services across the life course, barriers and solutions. Society has seen an increased need for mental health services for individuals of all ages since the start of the COVID-19 pandemic. According to the State of Mental Health in America website, as of 2022, 20% of Americans are experiencing a mental illness at any given time, and over 50% of these individuals are not receiving treatment for it. Research indicates that the mental health stigma is strong for both young adults and older adults, and services are often costly, resulting in mental health conditions going untreated. Having access to needed mental health services is correlated with a healthy workforce, which can help build our local, regional, and national economies. My research is a critical review of systematic review articles published in the last 5 years, from 2017 to 2022, that examine empirical research regarding access to mental health services among young adults and/or older adults. My critical review utilizes Yuri Brown from Venner's ecological systems theory to evaluate the following 3 questions. First, what are the barriers that young adults age 18 to 25 and older adults age 65 plus face in accessing mental health services? Second, what are the impacts of the barriers that exist to accessing mental health services for both age groups? And third, what are some possible approaches to overcome the identified barriers for both age groups? Answering the first research question, my critical review found that various barriers exist to accessing mental health services for both age groups. Social support such as family and friends, insurance coverage of services, the stigma around mental health, and discomfort discussing mental health conditions may prevent both age groups from seeking help. Research shows that there is a low level of mental health literacy among young adults that may serve as a barrier to seeking mental health services, while motivation to seek help may be a barrier specific to older adults. Regarding the second research question, this critical review found that the previously mentioned barriers for accessing mental health services increase the risk of suicide for both young adults and older adults. For older adults only, untreated mental health conditions can aggravate any physical health conditions they may have. For younger adults, delayed mental health treatment and misdiagnosis are linked to lower recovery rates from mental illness. For the last research question, research is showing that there are multiple ways to address existing barriers. For both age groups, having social support and being able to connect with others regarding their mental health experiences has been seen to be beneficial. Expanding access to telehealth services and health insurance for both young adults and older adults can help more individuals get the care they need. Some implications for policymakers would first consider current accessibility to services. As stated, expanding access to telehealth can help reach a larger population of individuals. Expanding insurance coverage for mental health services would help do the same. Second, engagement between young adults and older adults can help bring individuals together to share their experiences. Integrating interventions such as intergenerational programming can provide social support for both age groups. Lastly, consider education about mental health and mental health services to expand knowledge and improve mental health literacy. One way this can be done is through technology and integrating education through social media, games, and more. These interventions can help improve mental health and quality of life for both young adults and older adults.